Horizon House residents, I'm excited today for two things. This is the first time we are putting on a program. The Low Vision Hearings Challenged Committee is putting on a program this year during this time of challenge. And I'm also so pleased that Dr. Jo Munson is here with us to share and answer questions that you all wrote when we did a survey of what are the things that you want support from in terms of the staff and residents at Horizon House, and then what are your questions that you'd like to put to somebody who knows the answers to things like an audiologist would. And when I contacted Jo Munson to talk today, she did not hesitate for a minute to say yes. So thank you for coming and being part of this. I'm going to make sure that I hope that everybody turns off your microphone for right now, and then later we'll take questions. So Jo, if you want to get started, thank you again for preparing this and coming and working with this technology right now. Thank you.
Oh, well, thank you. Prior to this, Jeannie and I fumbled through me getting ready for the slideshow and being on the Zoom call. So kudos for her capabilities there. And to the residents at Horizon House to be voicing their questions and concerns about healthcare in general, but certainly for my field in audiology to say, what do we want answered? And I'm happy to do that. Jeannie, if we can go ahead and go to the next slide. A lot of, there we go. A lot of questions came through when the low vision and hearing group had submitted some of their questions for this slideshow. And that's what we're going to address today specifically. I'll be listing them out one by one. Next slide. And first of all, as an introduction of myself, I've been coming to Horizon House for a number of years. And one of my major passions that I get to share for the first 2 or 3 slides is that hearing care is very global in your overall well-being as far as your general health care. And finally, a few years ago, the American Medical Association said, yes, in fact, hearing health affects our overall health. Next slide. And it's one of my passions to help educate not only my patients, but the community, and for them to see that hearing as it's improving is also something that improves our health. And there's many things on the negative side that we can talk about, but I want to focus today on your questions and what the positive things are. But everywhere from the slide that you see, from fatigue to social embarrassment to stress that's bad on your system, it's all negative when we're dealing with untreated hearing loss. Next slide. So it is a big passion of mine to address those things. I have this information on our website as well for people to understand. Even when we're talking about mild hearing loss, it can affect our fall rate. It has a direct correlation with cardiovascular disease, and that has to do with blood flow. But there's links to Alzheimer's and dementia. That information's been out for a number of years. But overall, again, not only is my passion to help hands-on with people hearing with hearing aids, but just the education of our communities and our other healthcare providers, because it's not the funny little thing anymore when we just say, can you hear me? Or do I just need to talk louder and shout at you? So it's a bigger health issue than what we've thought in the decades before. Next slide. As many of you know, this is what we're talking about today. We're talking about the ear and then some questions of how to treat it. There's 3 slides here. If you just click through 1, 2, and again, the outer ear, the middle ear, and then the inner ear. It's the inner ear that we're talking about hearing loss primarily for our population at Horizon House. The majority of people that we treat have what we call sensory neural hearing loss. Next slide. And sensory neural hearing loss can be caused by a lot of things. I highlighted noise exposure, age-related hearing loss, and genetics. Those are the primary reasons our hearing changes. I liken it to just like our body changes in time. We have our hair changes. I color mine very well, but our body just changes over time and we can't stop it. That's the genetic side of things. So some of us might lose our hearing when we're younger, in our 20s and 30s and 40s, or even at birth. And others of us might only start to lose our hearing in our 40s and 50s. Common type of hearing loss. Certainly noise exposure can speed that up, and some other issues like medications and medical pathologies and diseases can cause it to be a faster accumulation of hearing loss as well. But ultimately, what we're talking about is sensory neural hearing loss, or nerve loss in the inner ear. Next slide. And there's 2 buttons here. Yep. So here are your questions. I actually go through about 6 of those clicks, Jenny.
Right, do 6 right now, or do it?
I'm just going to read them off for you guys. So here were your questions that came through from your vision, low vision, and hearing challenge group. How do you know when or if hearing aids can help you? Where should you go for that help, for that reliable help? What are necessary steps in being fitted for and buying hearing aids? What are the important features to consider when you do that? What are the range of costs and follow-up visits and insurance? We'll talk about that. The steps in adapting to the use of hearing aids. What are available technologies, earphones to supplement hearing aids, using TV, video, YouTube, telephones, and other electronics? That's actually a slide that I forgot, but we'll talk about it. I think there's 2 more clicks. What is a telecoil and why might I want one if Anderson Hall and Sky Lounge are wired for its use? I think that's it. What sources are common scams to be aware of? I think that was it. Yep. Oh, visual aid and lip reading. Okay. So we're going to talk about all those. So the first one, next slide, I think you'll click twice. The first question would be, how do you know when you might need hearing help or if hearing aids can help you? So like I said initially, that hearing loss is going to happen to all of us, no matter what. I'm going to stop just real quick. Can I get a nod of some people that I see that you guys hear me okay? Some of that will have to do with your computer. Okay. Would be a question I should ask initially. But how do you know when you're ready for hearing help? And certainly there are indications that you might experience, but oftentimes it's your friends, family, or loved ones that know that. Next slide. Or that bring it to your attention. But here are some signs of hearing loss. You know, we're starting to experience people that are mumblers. And if you think about when you were 20, maybe not everybody mumbled, but a few people did. So we're watching whether we feel like more and more people start to mumble. The difficulty understanding words in groups or with presence of background noise, trouble hearing consonant sounds or S's and T's that we produce softly. We call those fricatives. Frequently asking others to repeat words or asking them to speak up, turn up the volume on the television and radio. Sometimes we actually withdraw from conversations and we become a little socially isolated. Those are all signs. And then exactly what we think is that we would say huh and what more often than we used to. So commonalities of those will point you to the fact that huh, maybe you do have some problems hearing, but also listening to your friends and loved ones, bringing it to your attention. And it's often them that notice that first. Next slide. So this is a hearing evaluation chart. We call it an audiogram. You can click once or twice. The top part is measuring frequency from 125, I was getting ready to point, 125 hertz to 8. Speech usually lands in that purple section. There we go. That is highlighted for normal conversational levels. And then the volume of what we measure is on the left-hand side. And we measure that in decibels. If you click twice more, Jeannie. On the right-hand side, go ahead and click 3 or 4 more times, sorry. This is an audiogram we spell out, there we go. The right-hand side, we have the range of when we're looking at your hearing test of what's a predictor of might we recommend hearing aids for you. And the circles representing the right ear, the X's the left, that's standard in our industry. 0 to 25 decibels, that blue normal range at the top, is when we say your hearing is technically within normal limits. Once it drops below that, we start recommending hearing aids. It's very common that an audiologist is going to converse with their patient and say, how much trouble are you having? And take those into consideration as well. But from a mathematical measurement standpoint, this is what we're using, just the raw data.
So I don't quite understand what the normal and the amplification needed. Why is that part normal up above? And
great question. So if you take your cursor there, Jeannie, and run across the bottom section of normal, left and right, yeah, right there, all the way across. So
whoops.
that's okay.
Let me go back.
Yeah, so that is a level all the way to the left at 25 decibels. So, yep, if we're measuring slightly better than 25 decibels, which would be up, because better hearing is at the top, then we're not recommending hearing aids. But the hearing section that's below the 25 decibels, yes, that 1,000 to 8,000, is the area that we would be amplifying predominantly. So that's the area that would make this particular audiogram a candidate for hearing aids. Okay, does that answer your question?
Yes, thank you.
So this is our main predictor of what we're looking at. We do some other things in this test to kind of give us an idea of how successful you might be. Next slide. Most people are actually very successful with hearing aids. 95% of all hearing losses are successfully treated with hearing aids when they're fit properly. So it's not something that we don't know. We actually do know. And so it's not of, I don't know if hearing aids can help me or not. It's how much they will help you is the question. And that's something we also can kind of predict too within our testing information. Okay, next slide. So another question coming up, and that would be, where do you go for help? So go ahead and click again. What are the necessary steps? So I'm kind of putting some of these questions together. So where do you go and what are the steps when you're going through that process? So go ahead and click through again. Once again. So where do you go is really like you choosing any other provider that you have. If you're choosing an optometrist or a dentist or a podiatrist, any of those providers, you're going to want to meet them, you research them, and ask them all your questions of how they would treat you for whatever issue you're going in for. So go ahead and click through. I think 3 times, once more. There you go, right there. So when you're looking at a provider for hearing care, the factors that you see for influencing are proximity. What does that mean? That means how close are you, because you kind of need to go a couple of times a year. We're at Horizon House every 2 weeks. So you have access to us for anything in particular that you might need, but someone that comes to one of our offices, we have an office here in West Seattle and Renton, they I would ask them to come in 3 or 4 times a year just for routine exams and checking to see if I need to do anything. So proximity is a big thing. You don't want to go get a hearing aid in Minneapolis and live here. Provider education, of course, that matters because you want them to know what they're doing, their experience, how long have they been doing it. And again, these are things that are true with any of your healthcare providers. How do they deal with you on a personal basis? Do you guys get along? Because you actually have to see me on a regular basis, so you don't want to not like me. Whoever your provider is, you have to have a relationship with them so you can share what's going on, and that way we know how to work with you better. Their expertise, they might be, good at one thing better than another. That makes a difference in how you're choosing your provider. And then consistency of are they able to perform for you over and over and over and over. And that's the way I would choose my provider, whether it be hearing, eyes, or my dentist or my podiatrist. It's the same for all of those. That's the way you should go through the process of looking for the right provider. And next slide. And next slide. Or, yeah, click again. So what do you need? What are the steps when you're going through that process? Certainly, that hearing evaluation we looked at, that needs to be within 6 months. You need to have a complete eval. There are pieces in there that we need to look at that help us choose the right device or give you a success prediction, so to speak. So we need to have that complete hearing test. Next slide. Appropriate counseling. So that process, once you've picked your provider, you're going to have your counseling session. And that's super important for my office. We have another provider that does counseling and fittings for us as well. And helping you as the consumer patient be part of that decision process is really important. If you'll show the next 2 slides. I think it's 2.
Okay, let me get down here.
There we go. So here's our process. So, and there's one more, Jeannie. When we're counseling with you, we're looking at 3 or 4 things mainly, but I put in here 5. So we're looking at your hearing loss, and that is a predictor of what I might recommend. Your goals is very important. As an example, everybody goes, I want to hear better. Well, that's great. Most people do, but to what degree? So the question would be, a backup question would say, so are you wanting to help you hear television in the privacy of your home? Or do you want to go out to a noisy restaurant and be able to hear in that noisy cafe? And those are 2 different goals and 2 different performing hearing aids. So the more specific you are in your goals, the better
Oh, here it is. Come here.
Oh,
Can you hear me?
have a chance to pick the hearing aids.
Roy?
excuse me, could you mute yourself? Let's see.
Sorry.
All right.
All right. So hearing loss, hearing goals, your budget, that plays a role. Everybody wants to hear the best they can, usually. But if their budget, if they want to hear like they did when they were 20 and their budget is on the lower side of things, that's probably not likely. My analogy is if you want to go to the moon and your form of transportation is a tricycle, it might be a long time to get there. So that makes a difference. The cosmetics, not so much anymore. Hearing aids look so good. Nowadays, the cosmetics usually doesn't play a factor in the choice. Sometimes it can. And then I put in there longevity of the devices because that's important to me. It's not always important to you, the client. Why is that? Well, some people say, well, my budget right now, this is my first set of hearing aids, is on the lower side, and I'm probably going to get good ones later. So now I just want to get a cheaper set. That might be somebody's opinion. Another person might say, I only want to buy one pair of hearing aids for the rest of my life for the next 10 years or so. And then I might tell them, well, you better get the better set of hearing aids because it's going to be a better fit for your hearing. Not that they'll fall apart, but that we have more capability for a longer amount of time. And that's not an exact science. Again, it's one of those things where I want hearing aids to be effective for you for around 5 years. That's not a magic number. It's just, if you wear a hearing aid every day, 10 hours a day, in a waxy, dirty environment in your ear, just like you drive a car in a dust storm, after 5 years, it's probably going to need to be replaced. Reasons for replacing them could be you want better technology. I don't have enough power anymore to help you further, or the hearing aid's breaking down more. So those would be drivers. I'm starting to see some familiar faces over there. That's kind of funny. That would be the drivers to help us make decisions, okay, to replacing hearing aids. I hope this question was a little bit tricky because I wasn't sure what they were asking me for in that. And Jeannie, if you have any further comments about that question.
No, I think like on the budget, people are really curious about the whole range of what the cost is.
Okay.
And then do you get a proportional better thing? You know, you pay 10 times as much, do you get something that's 10 times better?
Right.
Or is there a way, what's the balance between getting top of the line or getting the,
Basic.
and you kind of put it in terms of your hearing goals, but
Yeah, let's go to the next slide. We'll talk about that.
Okay.
So I put some specific pricing on here too.
well, you had trial period just pop up too.
Oh yeah, trial period. So those are things that are all part of the process when you're purchasing hearing aids. So the decision, your hearing test, your decision of what it is you're going to do and how you make that decision are parts of the process of your fitting of the hearing aids. So the next one is going to discuss about pricing. If oops, hit the next slide. Did you go through 2?
I don't think so. Do you think I,
No.
do you want me, I'll go back.
Yeah, there's a price slide in there somewhere.
Well,
Oh,
not right now. So
All right, I'm going to get to pricing. There's a price slide in there specifically. Features. Here it is. What are the range or costs of hearing aid follow-up? So it's coming up. So the features to consider. So next slide. Features are different from being properly fit. So I wanted to clarify that. So in the olden days, features would be more like, did you want a program button? Do you want a T-coil? Did you want directional microphones? Those don't necessarily help you hear better. They do help sometimes with the whole coordination of what a customer is doing. And the reason I'm kind of fumbling over this is because a lot of this is old-fashioned comments versus what is available now, because we're so digital now. So instead of using a button, people are using their cell phones, right, to make changes to their hearing aids. So I wanted to be clear that features are different than being fit properly. And they technically aren't a piece-by-piece purchase. Hearing aids that we buy now are all inclusive for the most part, with the exception of a T-coil anymore. It's not like I say, oh, I want this piece and I build that, and I want this piece and build that. It's just a computer chip, like a motherboard. And then when I get it in the office, then I can program it to fit your specific hearing loss or your specific environment needs. And everybody's different. So just wanted to clarify the difference between that and achieving your goals. It's not the little pieces that you have necessarily, but getting the sound quality or the proper programming done correctly to help you here to meet your goals. That makes sense. Okay, let's go to the next slide. This is the money part. So again, things are like wireless connectivity. 90% of everything we're doing now is wireless, so that those are all things that are included now. Next slide. Rechargeability is something that is almost standard. We still can get battery operated hearing aids, but rechargeability is starting to be the wave of what everybody's doing because it's so easy. But we still do have battery operated hearing aids that are current technology and up to date. Next slide. Twice more. There we go. There we go. So answering the cost range. What is the cost range of hearing aids, follow-up visits, provider, insurance, etc.? So I've been doing this for a little over 30 years. 30 years ago, I sold hearing aids for about $850 a piece. Surprisingly, you can see on your screen, you can still get a hearing aid for $900. And people feel like that's a lot. Some people do, some people don't. And I agree. In general, $900 is a lot of money for a lot of people, but for the device itself, that's been that way for 30 years. It costs industry dollars about 80 million a year per manufacturer. There's only about 6 manufacturers per manufacturer, about 80 to 100 million a year, just in designing and researching better technology. So there's a lot that goes into building a hearing aid. It's not just a speaker, an amplifier. If it were, probably everybody would have one, but it's not. It's a lot more complicated, and the production of that is costly. So entry hearing aids, $900 or $800 a pair, and up to about $3,900 a piece or $7,800 a pair, and that's nationwide for an audiologist or an ENT office. Pretty standard, and has been for a number of years. What's the difference, you ask me? The difference in technology from a $900 hearing aid to, let's say, a $3,000 hearing aid is pretty vast. I'll give you a couple of parameters that make it different. So one is like a programming parameter. So how flexible is that hearing aid for me to match your hearing loss? It would be like asking your optometrist if you needed trifocals and ask your optometrist to give you everything you wanted in your vision, and you had macular degeneration, and you just wanted to get a reader and you'd fix your vision with a reader, and you needed all these other things in your prescription, but that's not what you wanted. You just wanted to go buy a $15 pair of glass readers to fix your eye issues. So the more complicated your hearing loss, the more sloped it is, or the shape of it, your word clarity. Again, there's a lot of factors that we look at are the dictators of what we might recommend for you. We want everybody to be successful, but if you've got a difficult hearing loss to work with, you're not going to be happy with a $100 hearing aid. There's not enough specificity in it from the manufacturer's side to be able to get the power or shape it or use any kind of noise filters, if they have one, to make you happy. Now, some people don't have high expectations, and some people just want a little bit of help, and that might be their motivation, is the $900, just a little bit of help, right? So those are the kind of things where when I'm counseling someone, I'm trying to pull out of them what it is you want. What are your goals, and how do you feel about healthcare? And are you always trying to address your healthcare with the utmost importance, or does it have a lower radar for you? And that helps us decide What technology? In some ways. I'll always recommend, this is what I think based on your goals, where you should go. I'll always recommend that. And then try to ask the customer, the patient, the consumer, what is your primary focus? To have that dialogue is such an important part, to go back and forth and say, okay, well, let's make sure we're picking the right thing that's right for you. Okay, because not everybody is as active as another person. Some people are super active and they're always going outside in groups and lots of people and they're social. And the next person just might want to stay home and watch television. So we don't have the same hearing aids for those people. Does that make sense?
Sure.
I'm used to doing the talks and live, and I get the yeah and the amen and that kind of thing. I'll just depend on you, Jeannie.
Well, I was going to say that one thing is the pair that my mom had could be adjusted over time. So she got a certain level of hearing first, and then she wanted later a higher level, and they could adjust those. She didn't have to buy a new set of hearing aids.
Yeah, that's the technology part. That's a great point, because all of these technologies have that capability. I'll start there, but it depends on how flexible they are, of how well I can adjust to your needs. So if your hearing changed a lot and I'm in a $900 hearing aid, I might not have the flexibility to meet your needs versus having a lot more capability of altering it. But yes, that's the whole idea about having programmable hearing aids that have been around for 25 years now, is that as someone's hearing changes every year, we can keep up with that prescription, assuming that we've got a technology that will grow with us. And that's what I meant by longevity of the device, meaning if your hearing changes, am I going to be able to keep up with your change if we're buying this lesser product? Does that make sense?
Yes.
Yeah. So yeah, the right answer to that question is it has to meet your budget, and it has to meet your hearing loss for what the audiologist is seeing on your hearing test. So those are kind of the predictors of choosing the right hearing aid with your provider.
So even if you bought the more expensive pair, you would need to think that probably in 5 years you'd get another pair? Or is the replaceability not as often if you buy a higher, more expensive hearing aid?
The 5-year mark is a kind of a standard comment to make. I've been telling my customers on my better end of hearing aids, assuming the hearing loss doesn't change out of this world or their environment. I mean, there's so many variables with a body's change of what they need on the hearing side. Sometimes I'm telling you 5-6 years, sometimes 7. Again, it depends on, is the hearing aid starting to break down, which that can happen after 3, 4, 5 years of use every day. Has your hearing loss outgrown our situation? And has technology changed such that there are some pieces that in new stuff would help you dramatically? Because, something might show up that helps this one specific customer super well. Let me give you an example. Like when we first were able to attach our hearing aids directly to a cell phone. Specifically, I had a customer that was struggling with working using a cell phone, and that was a perfect answer for them. And at the time, I think their hearing aids were only 3 years old. But out come this concept, and they were like, this is going to change my life, because it had revolved around their work. That's not true for everyone, but that's the 5-year mark is kind of a general statement to use, but they're not going to last forever. Okay, next slide.
We wish they did.
Oh, Jeannie, how much time do we have, by the way?
Right, we have about 20 minutes, but
Okay.
We'll have some questions for
Okay.
other people too,
So as far as the costs, follow-up visits and anything, additional, I've just kind of listed out in generic. If you go see an audiologist for a hearing test, that cost is going to be about $120. If you wanted to have a consultation for 30 minutes, maybe an hour, an office visit might be around $65. If you were buying an extra warranty on hearing aids, those can vary in cost from, $350 to $500. So I was answering this question because often these things are always included in hearing aids. Let's go to the next slide. But your audiologist is a professional healthcare provider, just like, again, your optometrist and your dentist. We're performing these healthcare acts based on our knowledge, our skill set, and our knowledge and skill set can vary, just like what we charge you can vary, just like your dentist that might charge you X amount of dollars for a tooth extraction and the other dentist down the road is a different price. That's the same for audiology providers. So I think because of the way we used to bundle all of our services under one umbrella of please come see me and please buy hearing aids, I think society's lost the concept that as a healthcare provider, you might have to pay a professional fee to go see a provider, right? Typically speaking, Seattle, this is kind of a generic statement, most of Seattle is still bundled in the sense of if you go there for your hearing test and your hearing aids, that you're probably not paying an office visit fee or a checkup fee, and they give you warranties on your hearing aids, and that's all included. But you can't go to the next person down the street and ask them to fix your hearing aid for you for free. There's just, that doesn't work. It would be like asking the dentist to go fix your tooth when the other gentleman took it out, or woman. So I just wanted to explain that because a lot of times people feel like once they get hearing aids that they're never going to pay anybody ever again to work on them. And that's not the case. Okay. Hope I answered that question well too. All right, next slide. Let's try to pair through so we can get 10 or 15 minutes of questions. Steps in adapting to hearing aids. Next slide. So it kind of depends on you. I think there's one more. Yeah. Can you hear that noise above me?
I can.
Mm-hmm. Yeah, I'm glad it's above you.
What did you say?
I said I'm glad it's above you.
You want me? I'm going to exit real quick just to ask them to stop.
Okay.
Okay, because I know it's loud.
Okay.
I didn't know you could hear me.
Well, apparently you're not on mute, but
I didn't, mute, okay.
we're going to have questions soon. So that I'm also at a place where there was a screeching noise this morning. And I thought, oh my gosh, here we're going to do a Zoom about hearing with a screeching noise in the background. But we found the source and got rid of it, thank goodness. But it happens. It will be interesting to those of us on the low vision hearing committee to find out from the rest of you what questions you have after this, or what feature of a program you'd like us to have. We have time reserved in the fall for a major program, and we can put on other programs. So I'll just say, well, here's Dr. Munson again, but we're curious about that. Thank you.
My building is being worked on, so that's why I ran out. Okay. Getting used to hearing aids. Largely, outside of me doing our job correctly, it's up to you, the user, to abide by how often you should wear them, which is huge, which is all the time. Practicing, being patient, and managing your environment. All of those are really on your shoulders. But yes, utilizing our services to say, how do I do this? How do I do that? Is really important. I'm gonna catch my breath. Let's go to the next slide, because again, I do.
When you say that, would it make sense at Horizon House that we try to help pair new users with people who use them already? Could we maybe come up with a way, like if you're working with people and say, to make us be partners to learn how to use these things?
I think that would be a fabulous scenario. I certainly hope that I'm providing my customers there at the clinic with the necessary tools. However, support groups have been made, all around the world, and certainly in retirement communities, to help each other kind of go through those things. And I'm happy to, even Jeannie, to maybe go so far to say is that if ever we wanted to have my participation in one of your groups Zoom calls like we're doing now, more frequently though, I'd be happy to answer questions in that scenario as well.
Okay. I just know from my mom, if she hadn't had one of my friends teach her how to use her hearing aids, she would have given up on them. And having that person saying, you can do this. And
that's why I think access to your provider is so important. It's not like you go to the grocery store and you pick out your hearing aids and you go home and you're successful. It doesn't work that way. So hands-on with a friend, family member, or your provider, I think is key.
so people can take that initiative themselves to get that, but maybe here we could make it clear that that's really important when you're getting a new device to set up some relationship or support.
Yes.
Okay,
Great.
on to your story.
Telecoils, you guys, I gave a telecoil talk at your community a number of years ago and was thrilled, that Horizon House had installed a loop system there at Anderson Hall. I did not know it was in the Sky Lounge, which is fabulous. What is a telecoil? Next slide. A telecoil is just a small copper wire inside a hearing aid that can connect directly to a loop system that a community or a building or an office installs. Typically, we install it in the ceiling. Sometimes it's in the baseboard, but basically, it's a streaming of that sound from a microphone, like in Anderson Hall, directly to your hearing aids without distance. So we call that streaming now because we can do a lot of that digitally. So because our hearing aids are now wireless and can do that. T-coils are still included in many hearing aids and still have a very popular use. It's been around for 50, 60 years, but we still utilize telecoils for different places like theaters and public places, but one-on-one as well. But some of that has been replaced by the concept of Bluetooth wireless devices.
So on the survey we did about hearing aids, many people say, I don't know if I have telecoil, and they said that they didn't know if their provider had turned it off or on, or, so I think I have it, but I don't know how to access it when I'm in a place like Anderson Hall.
Yeah. And so the only way you would know that, unfortunately, if number one, it needs to be a newer model hearing aid, and B, someone like myself or your provider has to go into your hearing aid programming and see if it's in there. And sometimes they do come that way. The early on hearing aids that were built like this early 15 years ago did not have a T-coil, and it was a space issue of putting everything in there. Some models just don't have them in general. So you have to go through a programming session either with myself or someone else to see if it's in there.
And would you recommend now that people go rather with Bluetooth than T-coil? I mean, if they were buying new ones, would you say, well, get Bluetooth is going to serve you more because it's the more modern technology?
It's not necessarily comparable.
Okay.
And there are different uses for different things. You know, again, not everybody is savvy with a cell phone. So there's more questions than just saying yes or no on which one. It would be more of a conversation of what are you hoping to do? Again, going back to your goals of where you can or can't hear.
Okay.
Okay.
So if a goal was to be able to participate in programs and hear programs here in Anderson Hall, a T-coil is a pretty important thing.
Yes, agreed. Agreed.
Okay.
Scams, I don't know of any current scams. Next slide. I would say in general, when anybody is offering you something that's better since sliced bread, it's probably not true. Next slide. But common scams or anybody that's trying to sell you something over the phone. Oops, back up one.
Let me go back.
That's okay. Oh, good. Our timing is great. We got 10 minutes for questions. Common scams would be, you know, somebody's trying to sell you something over the phone. Very, very low cost hearing aids, $6 million man hearing aid, online hearing aid sales is questionable. Sometimes it's okay, but you need to have that face-to-face test and a provider as well. So I couldn't speak to that necessarily as to I know something that's happening. From a professional standpoint, we go to school for about 7 years. I don't know of anybody that has my degree or profession that wants to lose their license. So the reason scams I think were thought of
already?
is that back years ago, before audiologists were dispensing hearing aids, there were licensed dispensers. You will find those at big box retailers. Not to say that a licensed dispenser is not ethical. I don't mean that at all. I'm just saying that there were more issues in our industry before people start having to have a license and an education to do what we do. Because, you know, if we're just talking about selling a vacuum versus, you know, somebody that has an education and doesn't want to lose their license, there might be more of a risk that the repercussions would be more painful than, oh, I just can't sell vacuums anymore. So yeah, I don't know of any scams. I certainly, again, go through the process of vetting out your provider online, you know, looking at referrals, how long have they been doing it, that kind of thing, to make sure you're seeing the right provider. And also just to say that if it sounds too good to be true, it likely is. It likely is. All right. I think that's it. Hearing aids, you know, today are pretty modern and slick. Next slide. So don't be afraid of them. We are at Horizon House every 2 weeks to answer questions and, you know, just complimentary clean your hearing aids if you need them. I'm here for you. Your family can call us and reach out and ask questions as well. Next slide. But most importantly, I wanted to say thank you to all the long timers of Horizon House. We've been coming there for about 20 years and appreciate our relationship with the residents there as well as the staff. And we're all each other, and we hope that we can continue our relationship together. So thank you, Jeannie, for having us. And yeah, let's have anybody ask some questions. We got about 10 or 15. I can stay longer, but
So let's switch. I'm going to switch on my screen to a gallery view. It seems like you might have had one. And if people will raise your hand, I'll call on you. And if you can unmute yourself, it'll be good. I'll try to help you if you have trouble with that. But who has a question or a comment?
I'm looking on here to see if I recognize any faces. There's a couple. There's one. Another.
You see some friends there?
I do.
Well, you know, like there was just an editorial in the Seattle Times that the state should say that there's people that are like nurse practitioners in the field of audiology, that if they had that there are these new less expensive hearing aids, and people who have who have very little money would have access to hearing. So what was your response to reading that editorial or that proposal that's in our state to have like audiology practitioners versus doctors?
You know, it's a great question. So first of all, our state, over-the-counter hearing aids for mild hearing losses was something that got passed. And I don't think that was a bad thing. I think the hard part is realizing that improper fitted hearing aids or not treating your hearing appropriately still has that long list of consequences, you know, of things that can happen. So because hearing is such a brain-oriented function or a sense that we have of how it helps us all sensory neural and all of our body. That's one of the reasons I was telling us how important it is. That if we're not, it's not as simple as going and getting a pair of readers and saying, okay, I'm going to treat my hearing to help me hear my spouse better. That might achieve that goal, but if you're incorrect in doing it well, then you still are in this category of all of these other health issues that can be caused by undertreated or improperly treated hearing loss. So that's my only concern. Again, I don't think that it's necessarily bad. I just think that it's not as much of an answer that people are looking for. So it would be just like if I have a history of heart disease in my family and I bought a monitor at Bartell's that took my blood pressure, does that replace my cardiologist? No. And so looking at it in that big picture that way is that hearing loss is not a band-aidable scenario. And I don't know that the intentions of us passing that law was, again, to band-aid it. I think it's trying to make it more affordable. But I think where we missed the boat is that affordability should go on the shoulders of insurance, as opposed to giving somebody a band-aid to self-treat themselves. That's where I have a problem with it.
Thank you. Well,
Yeah.
One of my friends explained to me that if you don't get hearing aids when you need them, you actually lose when you finally get around to getting them, you never can get the same capacity to hear. In other words, I don't know now that hearing aids are not such a big device that you put on your ear, that it's still an issue for some people in terms of worrying about what their looks are with hearing aids. But if you put it off, you actually can't later reclaim all the hearing that you'd get if you got hearing aids in a timely way.
That's partially true. I'll clarify that it's not about your anatomical hearing loss, but it's about the way the ear and the brain communicate. So the anatomical hearing loss that you have is going to happen regardless if you have hearing aids or not. But what does change, and that we typically can't recuperate, is that connection between the ear and the brain, of how clear things are to you. When that starts to decline, we call that auditory deprivation. When that happens, we typically can't recuperate that. So yes, the person that gets hearing aids, if you're a twin and they, 2 years earlier, one twin got a hearing aid and 2 years later, the the one that got theirs earlier will hear better longer. Yes.
Thank you. Doris, I see you have a question. Do you know how to unmute yourself? I bet you do.
Jean Worthen mentioned in a meeting not long ago that people who have eye problems assume that getting glasses will improve they'll be able to see better. And that that doesn't necessarily carry over to the same extent with hearing aids. People assume that when they get their hearing aids, they're just going to be able to hear better. There does seem to be a kind of a discrepancy there.
If your question is, is there a comparison of seeing better with glasses and hearing better with hearing aids? There is a comparison. If your vision is something that I can go from 20/60 to 20/20, that's our expected success at 20/20 for vision, right? However, if your hearing is, 40 decibels hearing loss, a mild, moderate hearing loss, do I get you back to perfect, technically 20/20? No. And part of that reason is the auditory nerve damage doesn't allow us to do that. Not that I couldn't measure it and give you more, but you would hate it. You couldn't stand it. Your auditory system would not be able to tolerate it. So there's a certain level anatomically where hearing aid users reach a point of, this is uncomfortable, it's worse, the volume is too high that it causes more hearing issues. And that's something that's part of your fitting process. But we don't, if we were to look at the hearing test slides ago, we typically want to get your hearing up to about 15 decibels is about where we would raise it. So if 0 were perfectly normal, we're not achieving that. But Doris, I would challenge the question to say hearing aids don't always mean better. If it's done properly, they are always better.
Can't talk now. Call me later. Sorry.
Okay. But Doris, you might have been on the phone, but I was saying that I would challenge your statement that hearing aids don't always mean better hearing. If it's done properly, it does mean better hearing.
Thank you.
Yeah.
You're here at Horizon House. Often in the dining room, they have background music. And about 1/3 of our residents identify that they have some hearing issues. If you could give advice to the dining room, would you say get rid of the background music?
Yes. Acoustical creation when you're building a restaurant dining room like that is very important, of how soft the materials are in the room, what kind of acoustical tiles do they have around you. One of the easier answers would have been in that creation to say, we need individual speaker volumes wherever we have our speakers in that dining room. That might have been a useful tool. I don't know if they have the ability to do that or not, but certainly there are some people that do not, especially in a group where other people are talking and the acoustical issues and the music, that's like a non-win situation. Does make it hard to hear.
So people in the dining room are trying to find what is the space in there that gives the best advantage to people who have hearing challenges. And people have tried different tables in different places in there, and so far they told me none of the tables work too well for them. Well, I'm wondering if you looked at that plan, could you say if they just did these few things in this space, it would make this cluster of tables more accessible for people with hearing challenges?
I look at it. I would probably defer to like the acoustical engineers, because sound is again, sound is complicated. It's not straightforward. So depending on the surface, the angle of the surface, the texture of the surface, the height of the ceilings, all of those, how much noise is in there? Is there any kind of reverberation? How long does the sound stay in that area? All of those things matter when you're saying what's going to be an easier place to hear. So I'd probably defer to an acoustical engineer to look at that. But again, it's not in any of the retirement homes that I go to. It's always the same comment, is that it's the most difficult place that we have to hear is in the dining room, which is unfortunate because that's where we commune, right? That's where we converse with some people that we haven't seen. And, that's one of the best parts about life is eating together. So.
Especially right now, we're so celebrating those moments we have.
Happy Cinco de Mayo.
Does anyone else have a question or a comment? Chuck, would you unmute yourself and ask your question?
Yeah. Jenny, Helen here.
Yeah, Chuck's unmuting Helen, and he's going to ask a question, then you can. So I could help Chuck too. Oh, he's unmuted. Okay.
The question that I have is not the ability of the hearing aid to work, but the size of it. I've heard several people getting together and they say that I have lost hearing aids because of the masks. And one of the hearing aids will flip off and they can't find it.
Yeah.
What do you do about that?
Well, I'm coming in my drawer here beside me. So I have extenders that I recommend my customers use. But basically, you can get them anywhere online. I think you can get them at Bartell's, but we have them here. And it takes the mask off of the ears by going behind the head like this or on the neck. So it's a little clip extender that goes on each side and pulls it behind off your ears. But yes, that, Chuck, has been an issue for a lot of people if they're wearing the behind the ear style hearing aid and have oxygen and have glasses. There's, our ears are getting a lot of stuff. So getting it off your ears, and some people are making them, they're people that make masks are making that strap to go here and here as opposed to here. So I think that's a huge thing. And it has changed our sales to a slight increase, for custom hearing aids to go in the ear, because who knows how long we're going to have to be wearing masks. Maybe the rest of our lives, we don't know, but it has spiked in the ear custom hearing aid sales a little bit, but for the majority, the behind the ear is still the most popular, and it's like about 80% of all devices sold are the behind the ear style.
Thank you.
Mm-hmm.
Helen, you had a question. Helen?
Oh, okay. Can you hear me?
Yeah.
Okay. I think I think there should be an assessment throughout the whole house, not just the dining room. It seems that everybody has hearing enhancements, hearing aid enhancements, or hearing helpful stuff, and it's all different. It seems to be different. It seems that I'm forever having to adjust my hearing aid to adjust to all of these items, to all this technology out there. Not only that, but then all the technology within my home that I have to adjust to. So the Bose system, the iPhone, the desktop, there, and then the HHTV. It's maddening. And I think maybe we need to have a review of what's available here and how to deal with it. So it's not just the dining room. I agree with that, but I can go to PT and I can't get through a session because we have to use the gym. So either I have to pick out my hearing aids and not hear what my therapist is saying, or I'm overwhelmed with the noise in there.
Yeah.
So I just think a review of what's in-house, not only for new people, but for the rest of us, and how can we deal with it?
And that's a great point too, Helen, in that the complication of hearing itself, one of the reasons that there's not, as an example, a consumer report necessarily that works for hearing, because there's too many variables. You know, if you're comparing a dishwasher, you might have 3 or 4 things that you're going to talk about, like, is it quiet? Does it dry them? Are they really clean? Those kind of things. In hearing, because the variables for hearing are infinite, they're infinite. From there's no one hearing loss alike, there's no one environment alike. You can't reproduce the variability of noise unless it's, you know, we have some ways to test in the booth behind me, as an example, some certain measurements of noise, but it's never the same. It's, you know, all of those environments are so different all the time that each person and their hearing loss and their hearing aids and their audiologist and that noise in that environment at that specific time is all different, and everybody's going to have a different problem.
Right, but I think when I'm talking about the house.
I know.
Enhancements.
Yes, I know.
Let's take, let's
Yeah.
put it all together so that I don't have to deal with the dining room, and then I have to deal with the meeting room.
Nice room, yeah. I think that's a great point. If there were things you could do to enhance your environment to make it easier for everybody, yes, that'd be a great idea. Yeah.
So Helen, I wrote down,
Or to at least be warned that in this environment, it's going to change drastically. Go ahead.
I was going to say, Helen, I wrote down your name so I can come talk to you and you can give me some examples of that. So we'll follow up on this idea. Are there any other, we have gone now 10 minutes past when we asked Joe to be with us, but, or Dr. Munson, I don't know, but is there one last question, or should we just say thank you at this point thank you so much for the time.
Very happy.
And I think you really did take our questions and answer them, and it makes a big difference to us to have those questions answered. So thank you so much. Thank you for being a person who comes to Horizon House, and I look forward to seeing you myself. And now I'll know when I pass you who you are. It's
Right.
great.
Well, here's the way you can recognize me, like this.
Oh, I see.
Right.
Yeah. That's a whole different person. Okay.
Right.
Thank you all. Thank you for coming this afternoon. And thank you again for preparing and answering our very specific questions.
All right.
Unless you're muted, but if you want to say something, you have to unmute. So,
Jenny, reach out to me if you need anything at all.
Thank you.
Jill, can you get those clips? Do you have them available here at Horizon House when you come?
I will bring a handful to Amy at the clinic on Friday. How about that?
Very good.
All right.
Yes, those would be wonderful.
They are super nice to have. Yes.
okay.
Good. Thank you.
Thank you very much. Thank you for.
Guys, bye.
Bye-bye.
Bye.